The Model Systems Knowledge Translation Center presents Employment After Burn Injury. This slideshow is based on research conducted by the Burn Model Systems and serves as a resource for individuals with burn injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This resource summarizes the research on returning to work after burn injury that can help people living with a burn injury understand why returning to work can be an important phase of recovery that helps one return to a routine. Returning to work is often accompanied by a confusing range of emotions, such as excitement and anxiety. You may not feel you're physically ready to return to work and do not have the stamina to work the same hours or perform the same tasks that you did before you were injured. If you are injured on the job, then returning to the same place of injury may lead to fear or anxiety related to the injury. How can you make returning to work easier? Some things you can do to make returning to work easier are: talk with your healthcare provider to evaluate your current work restrictions and communicate them to your employer. Prepare emotionally and physically during recovery. Seek counseling to help cope with psychological and emotional issues. Talk to your employer about other work opportunities. Stay in touch with your employer and express your interest in returning to work. Provide your employer with a time frame for returning to work and a list of supports. See your healthcare provider regularly. Workplace changes may need to be put in place to help you return to work. Your medical team may ask your employer for a job description to help determine if you are physically capable of meeting the demands of your job, or if you need changes made at your workplace to accommodate your disability. Depending on whether you are burned on the job or not, employers are legally obligated under the Americans with Disabilities Act and many state laws to provide you with reasonable accommodations. What are some typical workplace accommodations? Some typical workplace accommodations include a modified work schedule, or limited hours with a gradual increase to full-time, working in a clean and dry environment, limits on how much you can lift, limited or no exposure to extreme temperatures, adaptive equipment to help you perform your job tasks, altering work schedules to accommodate outpatient physical therapy and other medical appointments, special software and hardware so a person with limited or no hand function can work on a computer, and scheduling your return to work date in the middle of the week. This short week will be less physically demanding for you. Were you injured on the job? If you were injured at work, you were likely covered by a state's workers' compensation insurance, which varies from state to state. Your case manager is responsible for helping to secure benefits connected to an on-the-job injury. He or she can also help you get treatment and make the transition back to work go more smoothly. Your case manager may not provide you with all the information about what workers' compensation benefits you're entitled to, so it's important to advocate for yourself. What can you do to make the process for workers' compensation easier? Some of the things you can do to make the workers' compensation process run smoothly are: keep all paperwork, know your claim number, and stay in touch with your case manager. Always keep medical appointments. Remind your healthcare provider to submit the required workers' compensation paperwork. Do not ignore calls, mail, or other forms of communication from your workers' compensation program. Make sure your case manager knows the name and address of your healthcare provider. Maintain good communication between yourself, your healthcare provider, and your claims manager. Have the Independent Medical Evaluation, or IME, if needed. You may also want to consider vocational rehabilitation. This usually starts the first day you are admitted to the inpatient rehabilitation setting and continues after discharge, as a rehabilitation team and counselor continue to follow your employment status and provide help as needed. It can also take place anytime an individual with a disability needs help finding employment. Vocational rehabilitation support may include helping you develop a plan that includes specific employment-related goals and how to achieve them, helping you determine whether a potential job would be a good match for you by conducting a job analysis to determine specific tasks of a particular job, cognitive, mental or thinking, social and physical expectations, and the need for accommodations. Setting up a trial work situation with a potential employer to determine if you can do the job, if you like the job, and the accommodations you might need. Assessing your skills, limitations, health needs, work and education histories, interests, and even personality style. How can you find a vocational rehabilitation counselor? Some ways to find a vocational rehabilitation counselor are to ask your healthcare provider or burn center for a referral to a vocational rehabilitation counselor. Another resource is the State Department of Vocational Rehabilitation Agency, or DVR, which can be found in almost every state and may be able to help you train for a new career if you are unable to return to the job you had before your injury. Vocational rehabilitation services vary by state. State DVRs may enter what is called an order of selection during difficult budget times, which means that people with more severe disabilities will be given priority to receive services. If you have a long-term disability, you may be eligible to receive disability payments from the Social Security Administration, or SSA, if he or she is unable to perform any kind of work at a level of substantial and gainful activity, and the disability is expected to last at least a year. The SSA pays disability benefits under two programs. The Social Security Disability Insurance, or SSDI, is a long-term disability insurance program funded by payroll taxes. Eligibility is based on past work history and income. After a waiting period, SSDI recipients are eligible for Medicare. Or Supplementary Security Income, SSI, a federal welfare program for people with disabilities who are unable to work and are of low economic status. SSI recipients are eligible for Medicaid after 1 month. If you decide to return to work after receiving long-term disability benefits, there are federal work incentive programs under SSDI or SSI that allow people with disabilities to receive benefits and federal health care, Medicare and/or Medicaid, while keeping some earnings from employment. Two federal work incentive programs that help people with disabilities secure a variety of supports such as job coaches, transportation, equipment, and worksite accommodations include PASS, Plan to Achieve Self-Support, which allows funds used in achieving employment goals such as paying tuition for training courses to be excluded in calculating your monthly SSI benefits. IRWE, impairment-related work expenses, which can be claimed for your entire working life. In this program, work-related expenses, such as adaptive equipment or personal care costs, can be deducted from your income so you can retain more of your SSI benefits. It is important to be aware of the Americans with Disabilities Act, ADA, which prohibits employers from discriminating against qualified individuals with disabilities who are able to perform the essential functions of the job with or without accommodations. If you feel an employer has discriminated against you, contact the U.S. Equal Employment Opportunity Commission, the EEOC. More information can be provided to you by consulting with a physician or burn staff member, talking with your employer, and researching other resources to help take the steps necessary to return to work safely and successfully. For additional resources on living with a burn injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.